We are live, guys. We are live. We're live, but we're not live. We're doing one of those private lives, and this video is going to be very graphic. Very graphic. Just to warn you, I want to provide everybody an educational opportunity out there. Um, if you are maybe young and you have nice teeth, or you just have nice teeth overall, and maybe you know you take it for granted. I want to kind of just trying to educate people out there that you should always take care of your teeth, take care of your gums, because you could run the risk of getting periodontal disease, and therefore you might need some kind of treatment, like getting all your teeth removed, and get dentures, like I just did. So if you want to follow me throughout all the rest of the episodes of our denture journey, feel free to come on by. There's other reasons why people get dentures too. It's not just periodontal disease. But in my case, we're just going to focus on the periodontal disease and full extractions and dentures. And like I said, this video is graphic. I'm going to show you my surgery photos from the full extractions and the implants. All of this was provided by my cosmetic dentist, Shaun Janvier, the man, the myth, the legend, right here in Maine, Southern Maine. Very excellent place to go to, guys. So I'm going through a journey right now with my teeth. I'm wearing Immediate Dentures right now, but let's rewind the clock back a little bit. Let's show you what we looked like. Here we go, guys. Like I said, I warned you, it's graphic. You have been warned. All right. Well, not too graphic here, but this is what we looked like before. This is how our smile looked. And if you want to just compare what I look like now, let me do a before and after. Okay, so that's the before and after shot. And we had some issues here, with the teeth. That's the initial reason why I went to the dentist, was just my teeth were severely crooked, guys, and I didn't like it, and I needed help. And it took about 5 years to get to this point. So let's get to the next picture. Here we go. Oh, this is kind of sideways. Let's rotate this. So here's some equipment right here. I'm thinking on the right hand side, this is where they're gonna prepare the powder and the blood to make a bone grafting. I think that's what that is. Got some tools here. And we're just gonna get straight right into the business. A lot of these pictures are not in order, by the way. So what do we got here? Wow, holy shit. All right, so it looks like this is right after them taking all my teeth out, and like they are ready to prepare the bone grafting. That's what it looks like. I can't really tell. Again, I'm sorry this is not in order, so I'm going to try to instruct you all. Okay, so that's our denture. That's a dramatic transition right here. That's our denture, the bottom denture, the plate, and that's without any kind of reline on it, but that's what it looks like. And this is what our teeth look like on the side before it was removed. And that is my left-hand side. And we'll go to the next one. And right into business, guys. Right into business. Bottom teeth again. I really don't know what he's doing here. I just want to say that maybe he's doing measurements. Like thinking far in the future, trying to see maybe where these implants are lining up and how they're going to fit onto the bar, because I'm going to get a bar running across the implants. So I'm thinking these are like measurements. He's checking things out. All right, so I am like dead asleep, guys, in this one. So obviously I don't remember any of this because I just remember saying, "Wow, the room's looking really fuzzy and very wow." But it looks like they taped my eyes shut, and they just made sure this tube was staying put. Um, I think there's oxygen going through my nose. So after the surgery, the first thing I remember when I woke up was my throat was sore. And I asked my girlfriend like maybe 4 or 5 hours after, like, why is my throat sore? And then she told me that there was a tube that was running down, and I guess it ran all the way down to my throat. And there was some residue that kept on leaking out of my nose, over the course of a couple of days. So that must have been the lubrication coming out. So yeah, that's me kind of, dead asleep. It kind of looks like the teeth are already pulled out. I'm not too sure. All right. So what are they doing here? Well, my lips are all bloody, and my gums are all bloody. I do not see any teeth removed here. Really not too sure what happened here. Maybe they were trying to remove some of the skin to make this easier. That's just a guess. Here we go. I have no idea what's going on here again. But just some food for thought of what might be going on. Maybe this is how they remove the teeth. Yeah, I think this is him trying to remove some of the teeth. This must be like a guard to kind of stabilize the tool. I'm just guessing here. And look at that. See, you remove some teeth. Look at that. Move some teeth. My tongue is like, hey man, I'm just relaxing back there. And wow, look at this. All the teeth right here, guys. All pulled out. I'm trying to see if I can see any tooth in there that just like is recognizable. Nope, nothing recognizable there. Maybe we can rotate it a little bit for you. Kind of looks like a corned beef dinner without the corned beef. It just looks like bone. Okay, here we go. Oh, look at this. Where are we here? All right, so it looks like they put the denture in their mouth just to see how everything looks. I think this was meant to be sent home to me because I don't think they were able to do a proper fitting of the denture right away, right after surgery, and they didn't. It was just a couple days after until I got it. But I think this picture was taken for me to not feel discouraged right after surgery. That's what I'm thinking. But it looks really good, and I was happy to see that picture too, right after surgery. It's night and day difference, and obviously still asleep. So yeah, okay. Let's take a quick look here. What this tool is for. So I'm thinking this tool here kind of covers the teeth, and this thing lifts the tongue up. This metal piece lifts the tongue up and it keeps it in place. And then they'll probably take another tool and pull the selected tooth out. I don't know. It's interesting. All this is very interesting, and let's see what's going on here. Various tools of the trade. A lot of tools here. They use a lot of stuff for the surgery. Holy shit. And I'm doing this as a private live because I just want to make sure I don't see anything like with a lot of revealing information that might jeopardize, anybody, myself, my dentist. But this was shared freely to me for this reason to share with you guys. Oh shit! What's this? I have no idea what this is. Oh yes, okay. So obviously they did some bone grafting, and I'm sure that was a very serious procedure. So, They sutured everything up. I still have sutures in my mouth right now. Not as prominent as what you see here now. Wow, man. Look at that. So they did bone grafting. Really did a really good job. Made it nice and clean and everything. All right, this might, I don't know, if you're kind of squeamish, guys, obviously I'm out of it. I'm gone. So obviously when you put to sleep, you still get your flesh. You still look fleshy. Whether or not I was snoring or not, I am not too sure. Or whether I got an erection or farted, I have no idea. And I basically don't want to know. But I did wake up with a little bit of a blanket over me. And when you do go into this procedure, when you take your when you're being put to sleep, they do ask you, and they want you to wear underwear. I'm sorry, not underwear. What is it called? Briefs. Adult briefs. Adult diapers. So again, a little bit of pre-surgery stuff going on here. There's something in the back of the throat. So they did put a throat catch in the back. Yeah. So that's the throat catch. And that's I think that's why my throat was sore. It's like a little tampon back there. That's what it basically is. To stop blood from dripping in the back of the throat. Man, jeez. Yep, some more, inside of the mouth here. Okay, so here we are with the teeth pulled out on the bottom, but not sutured up. And I don't see any bone grafting in there yet. Trying to see if there's anything I should be aware of. It's amazing how they just keep track of everything. Like where all the certain places are in the mouth when it's all fleshy like that. Amazing. I find this all amazing, guys. I don't know what this is supposed to be. Just showing what everything looks like. And we're back to this photo again. So happy smiles with the denture in place. And what could this be? I have no idea what this could be. Again, we have some kind of tool on the upper lip. Maybe this is just a try-in for the shape of what the final bridge is going to look like. Trying to line everything up, thinking of the future. This is what it could be. I'm not too sure. Again, some more dental equipment. Showing more of the denture. Or maybe we're all done with the pictures. I think we're getting close to the end of the pictures. Looks like we got some skin here. Interesting. Oh, no, this is them putting in the implants. That's an implant right there. What's this? Looks all gooey. So I'm thinking this is the formation of the... Yeah, it looks kind of pussy, though. Like pussy. But I'm thinking that is the bone grafting material. Because they have to mix it with your blood. This again. Yeah, this is what it is. This is the bone grafting. It's like a powder, and it mixes with your blood. And then they insert it into the craters. Wow. And more tools here. bottom jaw again. Bottom jaw again. Top jaw. Top jaw looks healthier. Less bleeding. This picture again. And that's my teeth the way it was before. Tapered short implant. Oh, here we go. Some implants now. Starting to see some implant action. Yeah, that's the implant. I'm sorry, guys, if I'm just going through this fast. There are a lot of pictures that were shared. These are all the tools, man. There's the teeth before. Okay. I don't, like I said, I was put to sleep and then I woke up. I didn't feel nothing. All this, guys, I didn't even feel any pain. The only pain I felt was on day 3, like an achy pain, like ache. It's all been aches, nothing sharp. And the aches from, the level of the feeling, 1 through 10, it was like a 3 or 4. I'm serious, guys. It wasn't even bad at all. It was been a very comfortable experience. But if you look at this, it looks like, ow. And here we go. We're back to the beginning. I just want to double check. Yep, we're back to the beginning. So that was folder 1. And now you saw what all that looked like during the surgery, right? So at this time, guys, hopefully none of you guys got sick from looking at that. But as you see, it's a big difference from this to that. Amazing. So now what we're going to do is look at another folder. And this is about 18 minutes in the video. I hope I still have you guys. We're going to go to the week, a day 2 follow-up. I'm going to show you a few pictures from there. And let me get that ready now. And we're just going to select all the pictures and press open. And it looks like I have to stop the screen sharing and present screen sharing again for this window. This window right here. There we go. So that's what we look like when we came in. Big difference in how the face looks, guys. Big difference on how the face looks. It really changes the look of your face. And like the first 2 days, you're just like, what the fuck? And I'm still like that. Like, wow. When the teeth are out. It's a dramatic thing. And it can be funny. Really funny too. And like most of the time it's funny. The way I sound is funny. But when I'm like being serious about something and I sound weird when I'm talking, that's when I get a little frustrated. So I'm trying to work through that. But anyways, yeah. And that's profile of the face is different. It's shrunken in, it's pressed in. So you'll get this like a moon shape. Like a moon shape. Your nose, and then it just depends on your facial features, but most likely the lip area pushes back. And that's what it looks like on, what did I say? Day 2 follow-up? Yeah, this is the second day. So this is the day I received my dentures. And as you see right here, if you just remember looking at all that blood, and now we're looking at this, where it just looks pinkish, a little bluish. You can see the sutures in there. You can see a little bit of the implant sticking out. The white stuff is just some of the leaking. There's some leaking going on from the bone grafting. It's like a gel, and it's going to get harder and harder as time goes on. But just a little bit, like that leaking is fine. That's what he says. It's fine, and you can see some of the. I want to say plastic or maybe gauze or something sticking out, but that went away as well. So yeah, and that's the top. He did do some more sutures up there. He tightened everything up. So that's that. That again. You know, it's what we want to see. We want to see pink. Got that smile. And that's that. And now I'm going to show you the week 1 follow-up photos. And that's where we're going to be at currently. Okay. And I'm going to, if you can just give me a second, we got to do the same thing again with you guys. And we're going to wrap this video up here in just a few moments. Stop screen sharing and then present more screens to you guys. So if you guys have any questions, let me know. I mean, this whole experience has been a blessing in a lot of ways. You know, it just depends on the dentist you're going to. And this guy, he's been very good to me the past 5 years. Very, very pleasant place. Shaun Janvier Cosmetic, a family and cosmetic dentistry right here in Southern Maine. And we're almost there, guys. Just give me one more second. Just had a blonde, not a blonde moment, but had a airhead moment. Share screen. There we go. Here we go. Here we go. So this is our denture that was relined. So we got our first reline. And when they do the first reline, they put this material in there, and it kind of stings the gums a little bit, and it has a weird taste to it. They push your denture up in the gum really tightly for like 2-3 minutes. And then they do the same thing on the bottom denture. They make some adjustments, and then they do a bite adjustment. And they put like these like mini rulers, and they ask you to press down, press up, or press down, wiggle your mouth side to side, press up, and they do that with like each tooth. So, but after that, it didn't feel like I had huge fucking blocks of teeth or huge blocks of dentures in my mouth. It felt like, you know, I felt a lot better, 10 times better. But we'll talk about that here in just a second. And that's our gums here on week 1. And follow up, a lot better, less of the white oozing. Just healing a whole lot better overall. That's the bottom. Not bad. As you see, some of the sutures are kind of gone because some of the sutures were dissolvable. And that's our smile there. Oh, yeah, 10 times better. 10 times better with that smile. Yeah, man in black. Here comes the man in black. So, I'm going to wrap this video up, and I think 25 minutes is good, maybe a little too long. I just wanted to share with you guys, in summary, you know, my photos from this whole surgery that was provided to me to share and to actually look at. Very fascinating. And again, I just want to encourage people, you know, if you're going to get your teeth removed or you're opting to get dentures, you know, really ask questions, look back at my videos, guys, and see, you know, just try to listen best as you can to these talking head videos that I have, and take notes and ask your dentist if they provide these things, because I want you all to have the best experience possible. I really want you to get the best experience possible. I want you to get the best deals possible. I want you to ask all the questions before you even make the decision to go forward with either getting dentures, getting implants, you know, so, or partials, however, which way. Periodontal disease, ask about periodontal disease. See if you have periodontal disease. Check it out now if you're young. Seriously, I don't want to sound like I'm on a soapbox preaching, but really, serious, guys, please. So I'll keep on updating you guys as we go along. My next appointment is in the beginning of March, so about a month as we go. Right now, I'm just trying to get used to my Immediate Dentures. The bottom denture has just been a pain in my ass. Like, it's really hard to chew food lately. But it's one of those things where you gotta learn patience and just take it day by day. But there's a lot of benefits to this, but there's a lot of cons too. But we'll work through them. Thank you all. This is Jamie at Jamie Wilson TV. You all be good and have a nice day. And make sure you like and subscribe.